Good afternoon, everyone. My name is Courtney Goodwin, and I am the social media manager at Prisma Health. On behalf of Prisma Health, we would like to thank you for joining us for another Facebook Live Town Hall. March is Endometriosis Awareness Month to raise awareness about a condition that can cause severe pain and sometimes infertility in women. Endometriosis is present in 80% of couples with unexplained infertility and is a common condition in women with unexplained pregnancy loss. The condition can cause inflammation, which may damage the sperm or the egg and interfere with the woman's ability to get pregnant. So to close out this month, we are bringing together a panel of two Prisma Health experts that will answer questions and provide information on women's health. So on our panel today, we have Dr. Erica Lowing, obstetrician gynecologist in the Upstate, and Dr. Elizabeth Nodelman, obstetrician gynecologist in the Midlands. So thank you both for joining us today. So let's get started with our first set of questions. And these questions will go to Dr. Erica Lowing. So I'm going to go ahead and pop her up here. Hi, Dr. Lowing. How are you today?
I am great. How are you, Courtney?
Good. Thank you for joining us.
Of course. Thanks for having me.
Yes. So the question for you is, how long does it take to get pregnant? And can you boost your fertility naturally?
Yeah, so patients that are spontaneously conceiving, about 80% will conceive within about 6 months to 1 year. After that time, about half of the patients who haven't conceived will conceive within about the next 3 years or so. So I generally recommend that if you're under the age of 35, that you attempt to conceive for about a year before seeing a provider who may specialize in infertility. And if you're over the age of 35, waiting only about 6 months so that you can have a consult. I do recommend before trying to get pregnant that you do have a preconception visit with your OBGYN or other provider to discuss your health and your risk factors, your current medications, and how to optimize preparing for pregnancy. I also recommend that if you plan to defer childbearing and you're between the ages of about 32 and 37, you may want to talk to your provider about the option of fertility preservation, sometimes known as egg freezing. And here at Prisma Health, we actually have the Fertility Center of the Carolinas, the Upstate, and the Midlands who can discuss with you the options of fertility preservation. In terms of boosting your fertility, you need several things. You need to have regular ovulation, you need to have healthy sperm, and a pathway for those two to join together and then implant. And so you can predict regular ovulation by tracking your menstrual cycle. You can use a calendar, you can use an app. You should have a period about every 21 to 35 days, and your ovulation is fairly predictable to occur on the 14th day of your cycle. So if you say your first day that you have your period is day 1, count 4 days in the future, and that is 14 days in the future, and that's when you are most likely to ovulate. You can also use ovulation predictor kits that you can buy over the counter to track your ovulation. So there's multiple ways, and it's just patient dependent on how they want to try to track when they're ovulating. And there's a lot of things that can affect your fertility, such as chronic medical conditions, the disease of obesity, stress, tobacco use, alcohol use, substance use, and avoidance of these can help kind of boost your fertility naturally.
Thank you for the information. So the next question is, what are some common mistakes couples make when trying to get pregnant?
I think above and beyond, it's the timing of intercourse. So we just talked about when you ovulate, you actually want to have intercourse prior to ovulation. So you want the sperm to already be present at the time that you ovulate. And so typically I recommend having intercourse actually every other day. So the sperm is optimized after your period and before your ovulatory window. That allows for optimal sperm and the sperm to be present at the time of ovulation. I think people also forget that healthy sperm are needed too. And so there are certain factors that you can consider for male factor infertility. And then also not knowing when to see a provider. I would recommend considering talking to your provider about your planning for your pregnancy. If you have irregular, heavy, painful periods, if you have endometriosis or a history of STIs or PID, if you've had pelvic surgery or if you have chronic medical conditions, those are all good reasons to talk to a provider if you're planning for pregnancy or attempting to conceive.
Thank you. What can you do if you want to get pregnant but have an irregular period?
I would recommend tracking your periods, like I talked about, with an app, or you can use a calendar, and then talking to your provider, because there are ways that we can help. And if you've had that tracked, we can provide you with more information about what those options are.
Thank you so much. So now we're going to move over to Dr. Nodelman. Hey, how are you today?
Hey, I'm good. Thank you for having me.
Yes, thank you for joining. So the question for you is, can probiotics help with vaginal health?
So I do talk to my patients who have what we call chronic vaginitis, or you feel like you struggle a lot with vaginal discharge or odor kind of throughout the year. I don't have a study that says that a probiotic is a magic pill and you'll never have vaginal discharge issues again. But I think that, over the years, we're learning a lot more about how this microbiome that's in our body that's healthy is contributing to our overall health. So I think that if you wanted to add a probiotic, to possibly help with your vaginal health, I think it's a good idea to try. That could be in the form of a pill. Some people prefer yogurt. I think there is a thing on TikTok about putting yogurt in your vagina. I do not recommend that. But if you want to take an oral probiotic, I think that for some women, they find that it helps.
Yes, no yogurt.
Mhm.
Okay, so the next question is, do you have any advice on how to avoid vaginal irritation and infections?
Sure. So again, some women are more prone to this than others. So really kind of look and see what irritants are most bothersome to you. So we typically talk about making sure that you're using a soap that has no dyes, no fragrance, very mild soap. And you really just have to clean on the outside. So no soap or cleaning on the inside of the vagina, no douching. We want to make sure that we're wearing underwear that's cotton or a natural fiber, not some of these synthetic ones. Um, and you want to make sure it's the right size. So, if you've gained weight, it's time to buy more, new underwear. And then at night, I usually try to talk to my patients about trying to wear no underwear, no bottoms, just kind of letting things
Mm,
be natural at nighttime. Certainly during intercourse, and making sure everything is clean and cleaning afterwards as well.
absolutely, absolutely. Um, are feminine odor products safe to use?
I usually don't recommend some of the things that are out on the market. Um, it's very very much the marketing is real on social media and the moment you walk into Target. But most of these products can throw off your pH imbalance. It's best just to be as natural as possible. If you are someone who really struggles with your vaginal discharge, I would talk to your OBGYN, but I typically recommend boric acid suppositories before anything else that's on the market.
Thank you. So now we're going to go back to Dr. Lowing. Let me ask the first question for you here. So, what are some tips for coping with pregnancy symptoms at work, like morning sickness, fatigue, and frequent bathroom visits?
So this is tough. These symptoms are really hard to deal with, let alone not at work. But so for morning sickness, I typically recommend small, frequent meals of bland food. And it's important to know that morning sickness can sometimes not just be in the morning, it can be throughout the day or at specific times of day, depending on the person. And so just keeping that in mind and trying to keep those small, frequent meals. And then also trying to stay hydrated with water, maybe trying to avoid smells that bother you. And actually taking a prenatal vitamin can help. That does make some people nauseous, but in the long term, it actually helps with the morning sickness. Ginger can also be really helpful in multiple forms. You can get it in candies that can help improve your morning sickness. And if these things aren't helping or you're having trouble tolerating fluids or tolerating food, just to talk to your provider about the treatment options because we have lots of things that we can do. In terms of helping with fatigue, this is super tough. You just have to do your best to listen to your body. The hardest period of time is the first trimester and the end of the third trimester, where your body is just in significant fatigue as it's preparing for this pregnancy. And so trying to get extra sleep when you can, which is hard enough to do when you're pregnant, trying to take a short nap if you're able to, stay hydrated, eat those small frequent meals, and give yourself grace to slow down when you're able to. It's also important to remember that working during pregnancy is generally safe, but there's also federal protections that are in place to allow you to request workplace accommodations. Even things such as needing frequent bathroom breaks or access to food or water may be something that your provider could discuss with you and provide you with a letter and provide accommodations that are needed. And this also includes protection for postpartum breast pumping. And so it's important to talk with your job and talk with your provider about what options there are.
Thank you. That was great advice. So what are some signs you should stop working when you're pregnant?
So there are very few reasons to stop working during your pregnancy. There's many reasons for accommodations, but very few reasons to stop during pregnancy. And these are often personalized and individualized. The days of recommending bed rest are nearly completely gone. And so it's something that you really should talk with your job and talk to your provider about to decide what's right for you based on what your position is.
Thank you. And the next question is, what can you do to make the return to work after pregnancy easier?
Oh, I wish there was a good answer to this question. This is always a challenging transition, and there's so much of life to navigate, and no one's an expert. I recommend leaning on your community to seek advice and talk to other parents who have transitioned back to work after pregnancy. It's going to be hard. It's going to be based on your job. It's going to be based on the support that you have, but your community are the people who can make it easier.
Thank you. All right, so we're going to go back to Dr. Nodelman. Question for you is, can stress cause you to skip a period?
So certainly, stress adds to someone having irregular periods. It's typically more than just, I had a really tough project this week and now my period's weird. Usually it's longstanding stress, both either mental or physical. So sometimes we see changes in the menstrual cycle in people who have been admitted to the hospital for long periods of time, but certainly just ongoing mental stress in your life can change your periods. Also, for many of us, with stress can come with some weight changes, whether some people don't eat as much when they're stressed and can lose a significant amount of weight, or the other way around, we, stress eat and gain weight in a short period of time. So those big fluctuations of weight can certainly change your periods too.
Yeah. So when does heavy periods become a concern for women?
Yeah, this is hard. It's very difficult to quantify. Most women can't say exactly how many milliliters of blood they lose every day unless you use a menstrual cup. So I typically say, what is bothersome to you? So certainly if it's affecting your life where you can't go to school or work because you're bleeding so heavily, that's certainly too much bleeding. If you are having so much bleeding, some patients, bleed through a tampon and a pad and it goes all over their clothes. That would be very concerning. Signs of anemia. So you're feeling short of breath. You feel like you're going to pass out. Those are very scary anemia symptoms. And you would want to talk to a provider immediately or go to the emergency room if you're still having significant bleeding with those symptoms.
Thank you. Since we're on the topic of periods, some women want to know, is it safe to sleep with a tampon in?
Sure. I mean, I think ideally you would use a pad at night. Some people do use the menstrual cups. If you're somebody who has a pretty normal period where it's only lasting like 4 nights a month, then you're probably fine. But if you have a period that's very long or you're having very irregular bleeding, I wouldn't, be using a tampon, 14 nights out of the month.
Thank you. All right, we're going to go back to you, Dr. Lowing. I have a question. How does a woman's body change at midlife?
How doesn't it change? There's lots of changes that happen at midlife, and symptoms are often due to this drastic decrease in estrogen levels that comes with perimenopause and then menopause transition. And so people can experience what we call vasomotor symptoms, so the hot flashes, night sweats that we commonly hear about, also vaginal dryness, vaginal atrophy. Patients can experience weight gain. Skin aging, particularly in the face, is increased more rapidly after menopause. You can also experience hair loss. You can experience facial hair growth. There's also increased instances of sexual dysfunction as well as insomnia. So there's a lot of things that change, and oftentimes a lot of things that patients don't talk about with each other.
Right, right. So at this point in life, what screenings are important at midlife and why?
So there's lots of screenings that are recommended in midlife. I recommend breast cancer screening annually after the age of 40, and that there are certain patients who meet earlier screening criteria than that based on their risk factors. So it's important to talk to your provider about that. Cervical cancer screening is important throughout life. Typically, you get screened about every 5 years, 3 to 5 years until age 65. But you may need it more frequently based on your pap smear history. And so that's something to talk to your provider about. I also recommend colon cancer screening at midlife. There's multiple options for colon cancer screening. It's usually typically about every 3 to 10 years, but that starts at age 45. As well as osteoporosis screening, that starts at age 65, but it may be sooner based on your risk factors, medications, or your family history. There's also just screenings that your provider does that aren't tests that you have to do yourself, right? So there's screenings for anxiety and depression and intimate partner violence, and then also for medical conditions like hypertension, diabetes, cholesterol disease, cardiovascular disease, urinary incontinence, STDs, all based on your age and history. And so that's why it's important to have your annual exam with your OBGYN or other provider.
Absolutely. So the next question is, what are some signs of menopause and what can you do to make menopause easier?
So menopause is 1 year without periods. But as you're transitioning in perimenopause, your periods may start to spread out, or you quote unquote skip periods. You may start to experience the vasomotor symptoms that I talked about, or vaginal dryness, or any of those other things that I mentioned. There are some lifestyle modifications that can help, as well as cognitive behavioral therapy has been shown to help with coping with some of those symptoms. There's limited data on the usefulness of like supplements and things that are over the counter, but there are multiple medical treatment options that can help make menopause easier if you qualify for those based on your history. And so your provider can review those with you. I'm a huge proponent of women deserve hormone replacement therapy. And so if you're a candidate for that, it's really a great option.
Thank you. Let's go to Dr. Nodelman. So since we're on the topic of menopause, how does menopause affect your skin and hair?
Sure. So Dr. Lowing brought some up. Hair and hair loss, especially in your skin, is very multifactorial. So I wish that it was just one thing, and if we give you some estrogen, then your hair will be luscious and beautiful. But there's a strong genetic component. But certainly there are changes when we see that abrupt drop off of our hormones through menopause. So I would say, just like Dr. Loning said, the women know about hot flashes for menopause. I don't think that we're always as open about all of the other things that are happening. So I would say for my patients, once I start to really get into the nitty-gritty of what they're going through, I'm like, all of the things that you're saying can be attributed to menopause. And so hair and skin health is with that. But obviously what we put into our bodies is important. So if you have a poor diet, that's going to come out in your skin and your hair. And so it is a full package that I would talk to your OBGYN and then also dermatologist.
Right, right. So how does menopause affect our overall heart health?
Yeah, this is a really interesting question, and there's mixed data. We know that women who go through early menopause, so certainly before, the age 40, but even early 40s, their overall heart health risk is higher. Cardiovascular risks are higher. And we know that women who start hormone replacement therapy early, so when they're younger and they're late 40s, early 50s, have better cardiovascular health later in life. That starts to shift a little bit when you're in your mid to late 60s. So women starting hormones in that later time period may actually have an increased cardiovascular risk. But most women aren't starting menopause at age 65. So if you're starting hormones when your symptoms are starting in your late 40s, early 50s, then we do think that there's protective benefit for your heart health.
I have a question for you that came in. After menopause, do women need fewer daily calories?
Um, so in general, as we age, most people have less like caloric needs because you're having less output, I guess. So what's going in and versus what you're burning. Now, some women in menopause have very low energy levels, and I see that doing hormone replacement therapy can really help those energy levels, get them to the gym more often, so that they can be healthier. In general, you want to just, especially as women, as we age, we want to keep our protein intake up. That's really important throughout your life. But certainly we start to have more muscle wasting as we age. And so you want to try to combat that with increasing your protein intake and, doing light weights as exercise is very helpful.
Right, right. So why are UTIs more common after menopause, and what can you do to prevent them?
Yeah, again, this goes back to some things that Dr. Lowing was also saying, with vaginal atrophy, everything kind of changes down there as we start to lose estrogen. So some people think that, doing vaginal estrogen, which is very low risk, and it's very uncommon that somebody would not be able to use vaginal estrogen, can help kind of the overall vulvar, vaginal, and urethral health. So I would talk to your OBGYN, have an exam, see if some vaginal estrogen would be helpful for you. And then just in general for UTIs, again, making sure that what we're putting into our body is healthy. So water, and really cutting back on super sugary drinks and, drinks that have all the artificial sweeteners.
Thank you so much. Dr. Long, I'm going to pop you up for a second. We have a question that came in. Uh, when do menopausal women know they may need to ask for hormonal replacement therapy?
So that's entirely based on your symptoms. And so, like I said, menopause is 1 year of no periods, but you will often have symptoms before you reach that point. And so if you're experiencing these symptoms and you're in midlife, then I would talk to your provider about if it would be a good option for you.
Thank you. All right. Well, I believe that's all the questions that we have for today's town hall. I would like to thank our experts for joining us today to answer these questions. So at this time, I would just like to get final thoughts from our experts, them to wrap up and provide any additional advice. So Dr. Nodelman, bring you back up here. Any final thoughts on today's town hall?
Thank you so much. This town hall, I think, really had a good breadth of everything from periods to getting pregnant to menopause. And I think a running theme through it is to really make sure that you have a provider that you feel comfortable talking to about these issues, not waiting and suffering a long time at home. And just a big plug to talk to us, your primary care doctor, first before maybe going to TikTok.
Thank you. All right. Dr. Long, I'm going to replace you up here and go ahead and add your final thoughts.
Yeah, I second everything that Dr. Nodelman said, and to find a provider who you're comfortable speaking with, and don't be afraid to ask these kinds of questions, and to be open and honest, and hearing about what your symptoms are, because oftentimes people are afraid to ask the question. So it's what we all are here for. It's why we became OBGYNs and other types of providers.
Thank you. All right. Well, thank you everyone online for tuning in today. If you have any questions after our live, please leave them in the comments and we'll respond as soon as possible. If you would like to schedule an appointment with our providers online here today, please visit our website to make an appointment. Thank you all for joining us and have a great day.